Gilmore here. We are going to go over the kneeling with bench assist hip car controlled articular rotation. So controlled articular rotation is going to be super important for accessing joint range of motion, gaining awareness of the joints so that your joints can function better, can activate muscles better, and that way you will have less pain over time. So I'm going to demonstrate this. There's also a way to do this when you're sitting on the wall. We're going to use that, okay? You can do this standing as well too. I've taught different variations depending on the person. Today I'm going to show you an easier version. That way we can assist diaphragm support using our elbows, okay? So we're going to come down into a quadruped position where my knees are underneath my hips, okay? I don't want you leaning forward and I don't want you too far back. I want it to be pretty even as far as that goes. And I'm going to try to make sure that mine are pretty even. Okay. And it just depends on how comfortable you feel. I feel a little bit too far away from the bench, so I'm actually going to come in just a little bit closer to the bench. I'm going to dig my elbows in, kind of like plank position here. I'm going to get my rib cage locked down over those hips, so pelvis, rib cage, create that tension. And then I'm going to use my outside leg so you guys can see here. So the motions are flexion, abduction or outward motion, internal rotation, and extension, okay? If I've given this to you, you may just have a tiny knee circle for right now being able to control it. What I don't want to see is I don't want to see your pelvis and your back moving all over the place to do this exercise because that's definitely not what we want to do. So we don't want to do it that way. We want to make sure we maintain that good control. We're going to bring the knee up, out, and for now, just do up and out, back into extension, stop right there, and then back down. You can reverse the pattern, creating that abdominal tension. I should feel like I'm doing a plank right now. And then back. Now, the key in extension is you only have about 20 degrees of extension. I've got a little bit of a tuck in my pelvis right now to prevent my back from doing this exercise. If you let your back go, your back is going to be, see my back moving? The one that wants to do this extension, not your glute. We want to use the hip to actually control this. So I've taught some of you guys to tuck that pelvis a little bit to assist your hip and squeeze the glute, especially when I rotate over and back around. I'm even shaking a little bit. Glute at the top of it, come out, foot goes out and back around, okay? I'm also going to video this from the side so that you guys can see that as well. So here's the move from the back. I'm going to show you one with the internal rotation and one without. So there is the hip car on the left without, so just the small knee circle. And then there's that internal rotation. See, I paused there to get that extension, trying to control it, and then coming back around. Now, if you're just starting to do this movement, I would suggest just doing the small knee circle that I've taught you in clinic without that internal rotation right there before the extension. It makes it a little bit more difficult, but if you feel like you can do this and don't have any pain with it, then go for it. And there is the other just small knee circle with a little bit more abduction on that side. Notice how I'm tucking my pelvis here before I start that movement like I told you guys to do. So I demonstrate this a couple times so you can follow along. So those moves again are that extension, that rotation, abduction to the side, and then coming back into that flexion. If you have any trouble or have any pain with this, please let me know. Please reach out and let me know if you have any questions.